Your leadership and bipartisanship has proven to the nation that veterans are a priority. Without your intense oversight, veterans would still be waiting on hidden wait lists. Oversight wasn't enough. Your committees and staff then worked tirelessly to pass the Comprehensive Choice Act, setting a new course for accountability and access. Along the way, you also passed advance appropriations to ensure monthly veterans' disability and pension checks would continue should Congress shut down the government again. Already in this new Congress, you have passed the Clay Hunt Salve Act, providing resources to help turn the tide on veteran suicide. Thank you, thank you, thank you. Each year, in partnership with the independent budget, the VFW produces budget recommendations for VA's funding accounts. While VA's request comes close to reflecting the IB, several accounts fall short, including medical facilities, major and minor construction, and grants for extended care facilities. In April 2014, whistleblowers at the VA Medical Center in Phoenix, Arizona, exposed rampant wrongdoing, most notably the manipulation of waiting lists. To learn exactly what occurred, the VFW had held 2 Veterans Town Hall meetings and surveyed our membership. What we heard was both alarming and disgraceful. From this feedback, we compiled a report, Hurry Up and Wait, where we outlined specific policy recommendations to fix the VA healthcare system and to hold its leaders accountable. In an effort to mitigate problems with the new choice program and to gauge the pulse of the veterans community, the VFW launched a webpage where veterans could learn about the program. We also commissioned a direct survey where our members can provide feedback on their experiences with the choice program. We then compiled an interim report on what we heard from more than 2,500 veterans. The full report has been submitted with our written testimony. Our members are concerned with the use of the straight line distance to determine eligibility and not being properly informed of the choice program eligibility. Congress needs to amend the law by changing the choice program's geographic eligibility from straight line distance to driving distance. Our second survey indicates that VA is making progress in implementing the new law. As of February 20th, more than 34% of survey participants who are eligible for choice were afforded the opportunity to receive non-VA care, up from 19% at the end of our first survey. VA must continue to provide frontline personnel the training they need to ensure all veterans who are eligible for the choice program are afforded the opportunity to participate. While 92% of survey participants felt that having a choice was important, only 53% elected to receive non-VA care when given the option. This indicates that veterans who are presented with all available options make informed decisions that are best suited for their specific circumstances. Moving forward, VA must take lessons learned from this important program and apply them to its purchased care model. While the VFW believes veterans should be given a choice for care, specialized care services are unique to the VA, must not be hastily outsourced to private sector healthcare providers. Veterans turn to VA for such care because it cannot be easily replicated in the private sector. The House passed H.R. 280 on Monday. This is the first step in improving accountability. We encourage the Senate to quickly pass this bill, as well as both chambers passing H.R. 473 and H.R. 571. Congress must do everything it can to give the Secretary the authority to discipline and remove bad employees so the good work of the vast majority of VA employees can move out of the shadow of the bad actors. When Congress passed the Choice Act, a few members voted no. This is unacceptable, and those members heard it loud and clear from their VFW members. We will continue to track voting records, and our membership will hold any member accountable if they don't make veteran funding, care, and benefits a priority. While a majority of the focus has been access and accountability, Congress cannot neglect other health care needs. The House showed its commitment earlier this week by passing H.R. 294, which will provide increased long-term care facility options for veterans. Thank you, and we look forward to its quick passage in the Senate.